Thank you so much for being on Let's Talk About It today. You're welcome to this very exciting edition. Let's Talk About It is a contemporary Christian talk show. We get to talk about all kinds of things, all kinds. Those that have joined us in the past will tell you what an exciting time that we have together. And so it's really, really beautiful to have you here today. Today we're going to be talking about menopause. But before we go on, I just wanted to tell you a bit more. At the beginning of the year, God put us in our hearts that the theme for the entire year is going to be a better way. So a better way to do things, a better way to take care of your health, a better way to study, a better way to have relationships, a better way to create marriages, a better way to courtship, just different things. Whatever you can think about in your life and say, how can I do it better? That's what we're going to be addressing this year by the grace of God. And we look forward to you sending us topics or issues that you think we should address. We'll be very, very glad to do that. Let's Talk About It as a community of counselors. So here, I'm a host, I'm a counselor, but you are all counselors at the same time. And why do you think that is? Because the Bible says in the multitude of counselors, there is safety. You have some experiences that I've not had, and hearing from you, could save me trouble or direct me or help me one way or the other. And you hearing from me and from others on the platform, the same thing as well. We just get to share our experiences. We share our stories. We share our joys. At times there's some pain. We share that as well. That's what Let's Talk About It is about. And we're going to be playing a video very quickly. I don't know if it's, I think so Dami, did you play it before or should we play it again just in case? Okay, and then some people are with us on YouTube. So if you're on YouTube and you're joining us on your Instagram, thanks so much. We're really, really, really glad that you're able to join us. But while you're at it, before we get started, please send a reminder to that friend, that person that you know needs to hear about this. And it's not just for women, because I just finished talking to somebody about saying, oh, it's menopause, so it's women. I said, no, the reason why we have issues many times too in relationships, in marriages, is because the woman is going through menopause and the husband is clueless about what menopause is, even as we women are clueless about it as well, because historically, we're not told anything about it. Nobody sat us down to say, this is what is going to happen, this is how it goes, this is how you would feel, and, that's just what it is, So please reach out to somebody, giving you a few minutes. And while you're doing that, can you just let us know where you're joining us from? I'm in Lagos, Nigeria currently, and that's where I'm, streaming live from. Can you just let us know, where are you joining us from today? What's your name? What's your first name and where you're joining from? Is it your first time or are you always here with us? We would like to know that. Quickly, please. And while you're doing that, at the same time, remind somebody, remind somebody, please.
Instagram mostly, and we look forward to having you as part of our audience.
Everybody's joining us from yet.
We want to hear about your experiences, and we'll have a great time together as we walk and talk about it. Hello, you're welcome to Let's Talk About It. My name is Flakkie, and Let's Talk About It is a contemporary Christian talk show. We talk about everything, and you can join us on social media, one way or the other, on Instagram mostly, and we look forward to having you as part of our audience. We want to learn from you, we want to hear about your experiences, and we'll have a great time together as we walk and talk about it.
Thank you so much. So that's just our little, ad there, telling you what we're about. But I'm still waiting. I haven't seen any. Oh my goodness. I'm sorry. Yay. So I'm seeing that. Oh, wow. Okay. Jenny from the UK. Thank you so much. You know what? I think I need to throw these glasses on. So it's clearer. London. Okay. Lagos, Nigeria. You're welcome. Thank you, Kunle, for being here. Thank you, Tunde in Lagos here. Yinka from the from New Jersey, USA. Thank you, Sister Yika. I know who that is. Cinchi, and that's our guest for today, Dr. Sincheze Wapudike. She's joining us from Chicago. And we have, okay, somebody else from Essex. Wow, thank you. So those that have chosen to share, and I'm sure there's some on YouTube as well that have joined us. But we're going to get started as quickly as we can by introducing our guest speaker today. Our guest speaker, she's like the chief counselor, and then the rest of us are, support staff for today. Whatever, I'm already saying it ahead. If you're going through this already, or you've gone through it, or know someone that went through it, because every woman is going to go through menopause as long as we're alive. One of the things that bothers people is like they put like a stigma on it, like, I don't want to talk about that. We have to talk about this, because if people like me knew about that, we would not be worried and thinking about, why am I feeling like this? If somebody is in the audience and you have your own experience to share, let us know. It's important for us to share and talk about what you feel, or what you've heard about menopause, or what you think menopause is, just in case you're not even there yet, or what you thought it was and what you now experienced, like that. So different dimensions we're going to be looking at. We're going to move on. It's 3:10 now, Nigerian time. And say, okay, please, can we have the introduction for our dear speaker today? That's my friend, my sister, Dr. Sincheze Wapudike. Can we have an introduction on, please? We're just going to put it on the screen and you can read it, and I'm going to read out as well. One more time, please.
Hello,
reach out
everyone.
to somebody. This is a very weekend.
Thank you so
Please
much
go
for
ahead.
joining us today. So today we're having Dr. Sinche Wabudike. She is a board certified PAC for the past 19 years. She completed her undergraduate degree at University of Illinois, Urbana-Champaign. She then completed her medical education at MXC, Cook County Hospital Program, graduating the top 10 of her class. Sinche completed her master's degree at St. Francis University, Loretto, Pennsylvania, and has her Doctor of Medical Science, University of Lynchburg, Virginia. Her objective is to empower women through healthcare. Women are the cornerstone of the family. Healthy mothers create healthy children, contributing to healthy communities. She now works at Cook County Health as an advanced practice practitioner for the past 12 years. She was a professor and clinical coordinator at the Physician Assistant Program from 2010 to 2013. Dr. Nwabudike is married and a mother of 4 beautiful children. Please, let's put our hands together for her. Thank you very much, Ma. We're glad to have you.
Thank you so much for being on board here today, Dr. Sincheze Wapudike. Can we just spotlight her before let me know she's here? I saw her right there somewhere. Okay. Yay. Hi, Sinchi. How you doing? Oh, she needs to be on mute.
Thank you.
She's
Good
still-
morning.
Okay.
How are you? Can you hear me?
Very, very well. Thank you. Very well. Yeah, I can hear you. Can all please?
I can hear you, but it looks like there's you're paused. Can you hear me now?
I can hear you. Please, can
Yes, we
other
can hear
people
you loud
hear
and clear,
Dr.
ma'am.
Okay, thank you
Okay.
so much.
All right. So if there's a break, all right. If there's a break on my side, since you just take it on. So glad to have you on board here today. And I know this was an early morning for you, so I really, really appreciate it. She had to juggle her schedule because she had to be on this program today. So I really, really appreciate that. God bless you. And I know we're going to have an amazing time. But even while Dr. Sinchi is going to be speaking, I want you to take notes. If you have questions, please pull the questions. You can send them to me, send it to me directly on Zoom or on WhatsApp. If you have my number, I'll try to check to see if there are messages. Whatever way, just get your messages out. And if you want to share an experience, please let us know. And if you want to ask your question live, same as well. We're very excited to have that. And that'll be a good idea because other people's faces need to be seen as well, so that they know that we're not just creating, some fake experiences here. So first and foremost, I know that Dr. Sincheze, I know that menopause is just a phase of life. It's part of the life cycle of every woman as long as we are alive. So it's nothing to fear. It's not a disease. It's not an illness. There's nothing wrong with us when we go through menopause or when we will go through menopause, depending on what stage each person is at. Am I correct?
You're very correct. Good morning again. I did write in the chat that I am from Chicago. However, like you said, I'm actually in Dallas this morning for an event. So, and I'm so happy that we can make this possible. Like you said, I'm going to give a little introduction to menopause, right? So menopause is the natural biological process of a woman. So it's not something made up. It's something that almost every woman will go through. Okay, so it's the end of the woman's menstrual cycle. And in order for a woman to say that she's actually menopausal, she has to stop menstruating for a complete 12 months. That is 1 year. So let's say you started, you noticed that you're having changes in your menstrual cycle, like you didn't have a period for 3 months, and then you had a period. You are not menopausal yet. You are perimenopausal, but you are not menopausal yet until you completely stop for a full 12 months is the diagnosis or the definition of menopause. Is that clear? Any questions on that? Okay.
No, you can go ahead with the introduction.
Okay, so then there's something called there's phases of menopause, right? So perimenopausal, there's menopause, and there's postmenopausal. Perimenopausal is the transition into menopause. It can last from, everybody's different, of course. It can be up to 8 years or more, right? Because this is the transition in time that you're going into menopause. Like I said earlier, some women can stop at a certain stage and you start noticing the signs, like you start feeling hot flashes. That doesn't mean that you are menopausal, but you start noticing decrease in estrogen. And why is that? The difference between women and men is that when a woman or when a girl is born in utero in her mother's womb, she has all the eggs that she will ever have in her lifetime. So as she starts having her menstrual cycle, she starts releasing each egg, and that's what we have as periods. In that cycle, in the menstrual cycle where they release the egg, is where the egg is released, there's a sac called the corpus luteum. The corpus luteum is where these hormones called the estrogen and the progesterone are made. And that's what the woman uses as estrogen to maintain her body, her bones, it's a cardio protection. And as we go on, it starts decreasing. So that's why women go through menopause, because we start releasing, decreasing in our estrogen production. Another thing that is important for women to know, so that's basically it about hormones. There are two major hormones for women, the estrogen and the progesterone. Then that's what causes the symptoms that we experience, right? Because we're having decrease in estrogen production, we have things like hot flashes, we have night sweats, mood changes, sleep disturbances, vaginal dryness, and decrease in libido. Like that is, some women start having decrease in sexual desires. Basically, there's more work that we need to do. It just doesn't turn on like it used to, right? When you were younger. As you get older, the sexual desire starts decreasing, and that's as a result of decrease in estrogen. What are the things that we need to look at? We need to look at, there's some risk factors, causes and risk factors, why some women will go into menopause earlier than others, and some women don't experience it until later in their life. Some of the risk factors could be as a result of natural decline, like we said, the natural decline is a natural process for women in your reproductive hormones. Another can be as a result of surgical menopause. Some women, when they have removed their ovaries, remember I said that the ovaries is where these hormones are produced. Some women may have.
Dr. Sinchi, can you hear me?
I can hear you.
People, some people say your voice is a bit low. They're not getting to hear you properly.
Okay.
Or clearly.
Is it better now?
I think it is.
Can you hear me better? Okay. So I was talking about the causes of menopause. And the cause of menopause is the natural decline, like we talked about, the natural decline of your hormone. Another one is surgical removal of your ovaries. So some women may have to remove their ovaries. And why is that? Remember, ovaries is where the hormones are made. So if you remove it, you're automatically going to menopause, right? Because that's where the production is made. You may have to remove your ovaries for different reasons. It could be as a result of a cancer, of a tumor, whatever the case may be, they remove your ovaries. Another could be smoking. Believe it or not, smoking causes so many issues. Smoking can lead you into menopausal symptoms. Another one can be a family history. You hear people say, oh, my mom went into menopause at 35. So, those are things, when your doctor is talking to you, that's why they ask you about your family history. Not because they want to get into your business, but because they need to know, if you have some kind of genetic disposition, or is there some link in your family, like your grandmother went into menopause early. This helps for them to give you the best treatment for you. Another reason can be as a result of some kind of disease, chemotherapy, radiation, certain medical treatments can lead women into menopause. So like I said earlier, I said the diagnosis is clinical diagnosis based upon your experience. You have not having a period for a complete 1 year. That is how you diagnose a woman. Another one is blood tests. We check your FSH, which is the follicular stimulating hormones, and the estradiol, which is the natural form of estrogen in our body. So there's a number that they look at and to see if you're in menopause.
Okay, so something came to mind now. You said it takes a period of 6 to 8 years or something like that, right?
Yes. It can be
you
8
mentioned
years plus. And why is that?
8 years plus.
Why is that? Yes. Why is that? Well, like I said earlier, you have all your eggs, which is where your ovaries, your eggs, that is released out of the ovaries, right? From before you were even born in your mother's womb. So that's a long period of time. Yes. For females, we have all us in utero while you're in your mother's womb. So as you release, every time you have a menstrual cycle. And I believe, this is my belief, this is some of the things that our grandmothers communicate to us, but they didn't know how to say it properly, right? When they was like, oh, when are you going to have your children? When are you going to have, because I think they have an idea that you are releasing your eggs, right? So your viable eggs are made most in your younger years. As you get older, your egg production decreases. And they're all related to menopause. a natural process of life. Unlike men, is when they become puberty, is when they start making their, so they don't lose as the women lose. So it's inversely related.
Okay, so that it makes sense. So that's why you can have a something-year-old man having a baby.
Correct.
Yeah, and then okay, because he didn't have all his sperm in him when he was created by God
No,
inside. He only
no,
got that after puberty.
correct.
Okay, all right, please carry on.
So, well, I mean, people, I'm opening this up for people to ask questions. The other thing that I did want to talk about really is about management and treatment options. I want people to understand it is important to start treatment early because that's when you can give yourself the best chance to make a better impact. And treatment is individualized because guess what? Like I said, some people have genetics, family history. Your provider has to be able to talk to you to find out what works best for you. And it is a tailored treatment because what may work best for me may not necessarily work for you, right? And my family history may be different. I may have some health issues, health challenges that they need to put into consideration. Of course, they use hormonal therapy because you're trying to replace what is decreased. As we age, their estrogen is decreased really by 60, 65. The estrogen reserve is low. So they use that to replace hormonal therapy treatment. That's HRT. Some people, we also use antidepressants because, remember we said women go through mood swings, but that's just addressing a part of it. It's not really addressing the root cause of it. I know there was a women's health initiative that came out over 20 something years ago that scared everybody that hormone replacement therapy is not, it causes cancer. But honestly, they did not, it's almost like, let me use this analogy. When somebody spreads a rumor about somebody, but they never went back to correct it, or even when they corrected it, the rumor has already spread. When that women's health initiative came out in 2002, that's 2002, that's over 22 years ago, 23 years ago. It was because that research, that clinical trial was based on, it was based on women who were I think it was between 60 and 70 something years old, and they reported just the negative aspects. So once a negative report goes out, it is so hard to retrieve the good information that could have come out of it. And so many research studies have came out after that said hormone replacement therapy is helpful. I've given a lot of women hormone replacement therapy.
Okay, so
that has helped them.
Could you explain what that is? Okay, so well, let's do a recap. So you've told us what menopause is. You've told us how long you can't say you're menopausal until you've missed your period for 12 consecutive months, right?
Correct.
So as long as you're still having periods, sporadically in between, you're not yet menopausal. You're still in the perimenopausal stage. Am I getting it?
Correct.
Okay,
However,
good.
I just want to put a little add to that though.
Okay.
Menopause, perimenopausal is from, roughly on the average, is not everybody, age 45 to 55, around that space.
So like average age of 51.
Correct. Now,
okay.
But now, like I said, some people go into menopause earlier. There's always an outlier. There's some people, Now, if you're still bleeding at 60, please go and see somebody. If you're still bleeding at, there's a certain age, because if you have not gone into menopause, we also want to make sure that there's no cancer in utero. You don't have uterine cancer or something like that. Every woman that is having abnormal bleeding over 40 should have a biopsy to rule out uterine cancer. So you may be spotting, if anything is looking abnormal, you still need to see somebody. As a matter of fact, every woman should see her gynecologist, her health provider once a year for just wellness. Because, and I tell people this, they're like, oh, that mammogram hurts. Oh, I don't want to see it. No, we need to know what your normal looks like to be able to distinguish what abnormal looks like.
Okay. So bleeding after 60, from 60, there's something wrong with that.
No. Bleeding anytime over 40, abnormal bleeding.
Oh, abnormal. I was going to say, you need to define that, because
okay.
If I'm getting my periods every month, or if I'm getting my periods, okay, as I get older, if I'm getting it every 3 months,
So,
I don't think that's...
No, so abnormal bleeding is when, let's say you have your normal, so menstrual cycle, I'll give a little, the menstrual cycle on the average is between 21 and 35 days for most women. That's the average period of menstrual cycle. So let's say you've been getting a menstrual cycle every 35 days or every 21 days, and all of a sudden you're seeing your period every 2 weeks. You need to see your healthcare provider. It may be nothing. It could just be body changes. It could be, signs of hormonal decrease. It could be anything. It could be a fibroid. It could be a polyp. It could be anything. But it's good to get it checked so that you know that it is nothing, instead of just assuming that it's nothing. Then now going back into when you're now approaching into menopause, your menstrual cycle starts becoming irregular. Why is that? It's because this body has worked all its life. So, it's like a machine that has worked all its life. Then all of a sudden it's like, okay, I'm tired. I've worked, so it starts acting, the corpus luteum is not making that hormone like it used to. So, maybe to give you a cycle, instead of every month, I'm like, okay, 3 months. Okay, I'm done. So, yeah.
Okay, thank you. All right. So I think we have the basics now. And I said when we got started, that if you have a question, please send it to me directly, or better still, just send it. I think it's actually better to send it to the group. So you can send it to 2 people on the group and they'll be able to read it out. Don't even send it to me. I think that's better. Send it to there's Carol and there's Dami. Dami and Carol, can you tell them what your names on the chat is, so that they can send them to you, because they'll be able to read the questions out, and then Dr. Cinchi will be able to address them. All right, so Dr. Cinchi, we're talking about menopause, and so let me ask a question. Why do you think there's so much of a stigma attached to it? It's God's work. God created this body to work in a certain way. It's part of the life cycle of every woman. If you are alive, it means you're going to go through it. So why the hush hush around it? Why are people quiet? Why didn't my mom talk to me about it? Why didn't, so many moms say, I got to an age when I had to start thinking, wow, that's true. My mother's period must have stopped at some point, but I never knew when. I didn't know. I didn't even know, I was clueless. Why is there such a stigma?
Honestly, I don't know why, but I can only speculate to say that I think everything about women, if you notice, doesn't get spoken about. Once upon a time, there were not female medical doctors. There were male gynecologists. And no offense to any man that's on the line or anything. I'm just saying that women's issues were not addressed. And then men, if you're not a woman, so how do you address it? And I was actually listening to the chairman of the Postmenopausal Women's Society. She also mentioned that everything about women were not discussed or talked about. And the sad part about it is that it's women who go to the doctors the most. when you don't understand, and she said, or actually what I was trying to get out of that is what she mentioned, which is so true, is that menopause is not discussed that much in medical school. It's very little attention. If you need to educate yourself about menopause, you need to go and do some um, extra studies on your own on the side. It's a very small topic. So sometimes people are not comfortable to talk about what they don't have knowledge about. That also
Mm-hmm.
has to do with our nutrition. So
Hmm.
when people, if you notice, that's also another thing that's not taught much in medical school. In fairness to
Hmm.
medical school, there's a lot to learn, right? There's so much to learn about the body.
Mm-hmm.
They teach you the normal part, which is of your menstrual cycle, but menopause, it kind of gets dwindled off. As far as our parents, I think anything about your body, menstrual cycle. I remember one time when I was a little girl, I said, "Oh, somebody tickled me." My grandmother, I was raised by my grandmother. She shouted. She's like, "Don't say that." So that was considered sexual. So
Hmm.
anything about is like you're overexpressing sexuality.
Yeah.
So
Mm.
when you're talking about menstrual cycle, something that's coming out of your vagina, you're talking about sexual. No,
It's like
nobody
a
wants to talk.
taboo.
It's like a taboo.
It's
Nobody
like a
wants to talk
taboo.
about it. Nobody wants to talk about it. Nobody. But I mean, there's just so many unnecessary reasons. But now people
Okay.
are talking more. People are
I'm
being
I'm
more
happy.
educated and
Mm-hmm.
knowing that this is things that women are suffering from and they need help.
All right. Thank you so much. And when we sent out the flyers and information about this, I got such amazing feedback that I thought will be more than this on the platform right now. But like I said, it's a busy weekend. It's Easter weekend for most of us around the world. So I know people are busy at the same time. Okay, we have questions. So one of the questions is, at what age should a lady start seeing her gynecologist? Do I have to be married and or pregnant? When do I have to see my gynecologist every year? At what age does that start?
So as far as the United States in the Western world, which I also tell people everywhere I go, because I
Mhm.
um I go to Nigeria. I have been going to Nigeria even when I'm not there. I meet with women, widows, and I tell them you need to, because I've met so many females that came from Nigeria that has never seen a gynecologist, and that is so alarming to me, right? But according to the ACOG, the American College of Obstetrics and Gynecology, a woman is supposed to start seeing her gynecologist for a pap smear from age 21. So tell me, what does
Okay.
that mean, right? So you,
Okay.
what is a pap smear? Pap smear is a screening for cervical cancer screening. Every woman that has, which they shouldn't if you're not married, but whether you're married or not, you need to have a cervical cancer screening. So if you need to have a cervical cancer screening and you need your gynecologist or primary care doctor,
Mhm.
I would safely say age 21.
Age
Now, if you
21.
age 21, yes. And so that's to start your pap smear. Age
Okay.
40 to start your mammogram. So,
Okay.
and so you need to see a professional every year to address whatever issues. And can you imagine from 21 to 40, you've gone through some
Okay.
stage differences that you need to see somebody to see
Mm-hmm.
what's going on. Now, I
Okay.
personally will even say younger, from when you start having your menstrual cycle, so you can understand your menstrual cycle.
I think
From
it's early. If I start at 13 or 12, I don't think what.
it's not to talk about, it's not to talk about, is to understand your menstrual cycle, to understand what's
Okay.
happening in your body. You understand?
Okay.
A lot of young
Just
people
to
start having
talk.
their period. Exactly, just to
Okay.
talk. They can still
Okay.
see their doctor. They should be able to explain to them. I'm just saying they need to start having an awareness what's happening in their body. What does the
Mm-hmm.
menstrual cycle actually mean? what is
Mhm.
happening in their body.
Okay. All right. So I have a question here. We're going to get lots of questions because I think the questions will help us, navigate this better. But you should prepare to tell us more about hormone replacement therapy, HRT,
Mhm.
so that we know what that is, what the effects are. Is it a good thing? Is it a bad thing, and all that? But in the interim, I have a question here, and the person says that she's 57, and what can she use to replace hormones? So I guess I'm in line with what she's saying. She says she still feels dryness, and she's asking how long is she going to take Primrose and omega-3, for, because she feels
Okay.
dryness there. She thinks, yes, and she's 57.
Okay. So I've never prescribed Primrose. I mean, I take that back. So that's an over-the-counter or herbal medication that you can use
Mm-hmm.
off-label. Now, I
Okay.
don't prescribe to it because I have a license. That is
Okay.
something over the counter. You can advise somebody to use it. However, why I don't is because, like I said, I have a license, it's off label. I don't know what the dosage is. I can't regulate it, correct? Now, some people say Primrose has some kind of level of estrogen in it. If it helps you,
Mhm.
it's up to you. I mean, some patients can start using it if you don't want to go on prescription yet. If
Okay.
you don't want to be on medication, you can try it and see if it works for you. But if
Mm.
it's not working for you, you
Mhm.
need to see your healthcare provider so that they can get your history, make sure there's no risk of cancer or any sort, for you. And then they can
Okay.
start on a low dose, you know, um, estrogen, any estrogen product. We use estradiol. We can use norethindrone or progestin. If you don't want to take anything internally, like some people don't want to take any, there's transdermal, there are patches, there are
Okay.
creams, there are gels that you can use.
And all those
Estrogen,
are hormone replacements?
all those are hormone replacements. So,
Oh,
yes. So they have them like in gel form, in patches that you can use, estrogen
okay.
patches. Now, let me
Okay.
just, I'm going to reverse for a minute. Before you start using any estrogen
Okay.
or any hormone replacement therapy, which your provider should tell you, it's important to find out. That's why I say history is important. Have you had a
Okay.
hysterectomy or not?
Hmm.
If you've had a hysterectomy, you don't have a problem. If you have not had a hysterectomy, you want to make sure that they're giving you something for uterine
Okay, since you're
protection.
talking to most of us are non-medical, you have to tell us a hysterectomy is what? Because you're saying that like we're all in the medical field with
I'm
you. I know
so
what it is,
sorry.
but not
I'm
everybody
so
knows
sorry.
that. Okay.
I'm sorry. I'm sorry. I'm sorry. So basically, some women have had to remove their uterus
Okay, the
and
womb.
their womb, and that is
Okay.
a hysterectomy, right?
Okay. Okay. Okay.
Um, so if and why is that? Because once you go through menopause,
Mm-hmm.
um, estrogen declines, which is a
Okay.
good thing. That's the natural process of life. Why are
Mm-hmm.
we having this conversation? Because sometimes estrogen declining causes other symptoms, right? Like hot flashes, like mood swings. So it is a good thing when estrogen declines, but when I'm adding back estrogen, it can cause your womb to start growing cells.
Oh,
Cells, what are those cells? It's not a bad thing, but it's cells that it's really, that's our menstrual cycle that flushes off that period. So let's say you start taking estrogen products and you say, oh, my boobs is feeling tender again. Those are what the estrogen products and the progesterone does for us, right? So when you're in menopausal, you don't think you should be feeling those symptoms. Well, you replace estrogen into your body. So when you replace estrogen, it's going to do what estrogen used to do in your body.
In your body. Okay.
Exactly. And one of it is it starts growing cells in your womb, your uterus, as if you're about to have a period. And that's
Okay.
what women flush off as blood. And then they're like, oh, the estrogen made me bleed or something. No, it's just it's doing what it used to do. So hormone replacement therapy, replacing what we lost. And it's not
Okay.
going to just replace one thing, it's going to go and act on everything in your body.
My goodness.
Yeah.
Okay. So
So
now go on, sorry.
no, go ahead. So it's not, I mean, it doesn't happen to everybody. It may not replace enough where it will cause all that, but some women feel effect right away. Like, ooh, I felt my libido. I felt sexy. I felt like I want to have sex.
Okay.
Those are the things. Okay.
Okay. All right. So we're talking about menopause here today. If you're just joining us, and we have our medical personnel in the house, Dr. Sinchese Wabudike. You can see that she's a very exciting person. We have loads of questions here. And some of them I had said it to some people. Some people sent it to me privately. I understand. And this person says, I am 53. I'm going through my perimenopausal stage. I do not have a change in my libido that's negative. On the other hand, I think my libido is actually higher. Is there something wrong with that? Because you just said that most people go lower. I think mine is higher, and I'm 53. I'm perimenopausal. So that's one
No,
question. Can you answer that?
yes. So, yes, everybody are different. Some people, that's what, remember I said everybody's history, some people, their libido go high. Some people, it goes low. But majority of women, it goes lower. But I
Okay.
mean, there's nothing wrong with that. If your partner is ready for you, then hey, there's some people who want to, who wish they have that.
Okay, all right. And let me make fun of myself. For the longest time, whenever I had HRT, hormone replacement therapy, I just thought it was something like they would hook you up to some IV and then you'll be in the hospital. I don't know why I thought that. I do not know why I thought that. But honestly, for many years, that was what I thought. When I started reading about it and I realized that,
Yeah.
there are different ways to have HRT and people have different
Yeah.
effects. But the one I didn't even know about was the fact that you could start having periods again. If you start having periods again, can you get pregnant again?
um, so medically, I would say no. However, as a Christian, and so this is where medicine and Christianity, is there's a fine line, right? I always tell people I'm a Christian. I've seen it. I've seen my sisters get pregnant at 50 something. I've seen so, and guess what? You could, because that's what the experts, I'm not an expert in infertility, although we do help patients starting out. These are the things, what do you think they're doing to help patients get pregnant? They're giving them hormones, they're injecting hormones, those are part of the infertility treatment. So it depends on the stage you're in menopause. Let's say your I call it your menopause, your pause early for some reason. They may be able to help you unpause it by giving you hormones, right?
So
Like,
pause it.
okay, yeah. So it's something called ovarian failure, like where you went into ovarian failure. So you have it went into menopause early. It's
Too
like
early.
your
Okay.
ovaries may not be, insufficient or something is going
Okay.
on.
Okay.
We treat that with hormones. So
Okay.
same thing. Okay. But that's
Okay.
why it's important to see your provider, so they will run the blood test. They would ask your history, determine, okay, what is going on? Why did this happen? And those kind of individuals, when they go into ovarian failure or insufficiency, they need to be tested to check their bone reserve, bone density, because these are all the things that could cause osteoporosis, osteopenia, meaning decreased bone. You're no longer making new bones, and that's what some people have as brittle and osteoporosis.
Okay. And all right. Well, for those that are just joining us, we're talking about menopause today. Like I said, we have Dr. Sinchi in the house. Well, for the men that are in the house, we're really thankful that you're here. I see a couple of them, and I think it's amazing. And the reason is because I encourage men to get into women's issues, because if you're married, you need to know. You have, and if you're not married yet and you want to get married at some point, it's important to have this kind of information. Well, women go through some of these issues. Some women go through all of them during menopause. I want to read some out, and some of the ladies here might be able to say, yes, I went through that, or I'm going through that. So I think one of the most common is the hot flashes and night sweats. So we'll talk about that. And then we have fatigue. I have some things written down. You have fatigue, people just being tired, and they're like wondering what is going on. It's part of it. And she spoke about the bone density issue. That's osteoporosis, when the bone starts to thin out somehow, right?
Correct.
That's what it is. Okay, so some go through that. So they start getting, they fall
Sorry,
down
ma.
and their bone.
Hello, sorry, ma.
Yes.
Dr. Sinchi, could you
Yes,
disconnect
I can hear
your
you.
Bluetooth microphone so that we can hear you properly? If that's possible, it would be much better, ma.
Okay.
Yes, ma'am.
Hold on, let me. I was trying to hear you better. Hold on, let me.
I think you might have to change it as well from
Is that
your.
better?
Probably you switch it off, ma.
Hello.
Switch
Give
off
me
the
a minute.
Bluetooth, ma.
Check something.
You have to switch it off.
Yeah.
They said my mic.
Okay, are we back? Okay, do we have our guest speaker back?
Yeah. How about
I think
now? Is that
much.
better?
Yes.
Better. Thank you.
Okay.
No problem. I was trying to be polite and not be rude to people around me. All right.
So I was just reading out some things that women go through during menopause. Spoke about say hot flashes and night sweats, vaginal dryness, chin hairs. How many women just realized that they are suddenly growing hair in places they didn't have hair before? And they're like, what is going on with me? And in my class chat a few months ago, somebody was making fun and said that she's getting hairs in places that people used to say is only witches that got hair in those places when she was growing up. And we all had a good laugh about it. But I think that's real, that, you begin to get hair. Not, like I said, not everybody will go through every single symptom, and not everybody will go through the ones I'm even saying. So if there are some symptoms that you know about that you went through or you're going through, someone that's, please put them in the chat so that we can see that. Osteoporosis, that's the lower bone density, the growing of hair in funny places that you didn't think about before, like chin hair, vaginal dryness, fatigue, insomnia, joint pain, and then some people say lower libido, and somebody else just said no, mine went higher. So there are all kinds of symptoms that men need to be aware of. And then there's mood swings, and you're like, what is wrong with this woman? This minute she's here, and the next minute she's, somewhere else, So men and the ladies on the platform as well that have not gone through it or are not going through it yet, these are some things some exciting things you need to look forward to experiencing.
I want to address something quickly. I just saw a comment, like some women are caught off guard about the mood swings. And this is why I love, let's talk about it. I love, This is why keep saying this is why you need to see your healthcare professional. Women need to talk to women. They to understand our bodies going through changes. I tell my patients when they come in, every decade of your life, there's some kind of change you're experiencing. Why do I say you need to see a health professional? Some of these things mirror each other, right? You said fatigue. That could be also a sign that your thyroid is not working. You know, so that's why when you see your doctor, there's a reason why they run the test, not because they want to take your money, not because you know, if it's not a menopausal issue, they need to address what the issue is. As simple as maybe you need to be on some kind of Synthroid, some kind of thyroid medication. Your thyroid can be overworking or underperforming. They're all hormones that work together. They don't work separately. They're synergistically working together. So when a woman comes into our clinic, not only do we run her female hormones, we run her thyroid because they're all hormonal. They're going through the bloodstream. So it's really important that they check all your various types of hormones, because you can also be going through thyroid function. Thyroid can cause dryness, skin. Menopause can cause skin dryness. Dryness, it can be dry anywhere. You could be taking a medication for example, urinary incontinence. And some of these medication is trying to keep you dry, but it doesn't just dry you from urine. It would dry eyes, dry mouth, dry, you know what I mean?
Goodness.
Those are like the older generation medications. Now they have newer generations, but
Thank
you
God for
know,
that.
they start most, like, I don't know about Nigeria, but in the Western world, before they can start you on another medication, the insurance company wants you to use the older generation first before they pay for it. So some of those medications, if you remember earlier, I said the things that could cause menopause, one of them, that's the last one I mentioned, could be medication. You could be going to chemotherapy, any, you know, or any kind of medication that has other side effects. Medications are great, but it's important that we're reading, looking at things to see what's going on. And yes, it can cut you off guard when you don't even know what's going on with you.
That's right.
And it's good to keep a diary of the changes that you're experiencing.
Keep a diary. Keep a diary of the changes you're going through. Okay, that's good. Dr. Sinchi, thank you so much. We're still on questions and answer, and I'm trying to get to another one. Oh yeah, and this person is talking about how do we, it says, how do we address the cultural or religious taboos? I think this question isn't just for Dr. Sinchese. I think it's for everybody on the platform. How do we address the cultural or religious taboos that make well-meaning families avoid talking about reproductive health and, and identity early enough in girls? People don't even talk about periods, and so this is true. How do we do that? By what we're doing right now. I think it's education, getting information out, debunking those myths, and letting them know there's nothing wrong with speaking about it, and letting girls own their body in terms of, this is my body, this is how God has created me, and it's nothing wrong with me that I have a period. There's nothing wrong with me that I'm going to go through menopause. It doesn't mean my life is over. And that's another thing I wanted to address. There are many people that go about, if you still want to have children, or if you want to have children, I totally understand. And as a person of faith, I stand with you and say, if you don't have your children yet and you're seeing those signs, God is able to reverse anything. I'm a person of faith. I don't have shame, with regards to that. There's no shame. There's no shame at all. I'm very, very, open about my faith. But at the same time, it doesn't mean you just shut the area out.
Blinders. You work with blinders. And that's what I was saying as a professional, and as a woman of faith. It's important to have to be informed, to have all your information. You cannot be ignorant about anything. It does not help us. Even God does not want us to be ignorant.
Ignorance.
To find out information, read, ask questions. It helps you to make an informed decision.
Okay.
Basically your statement about how do we debunk this? I tell people you need to, especially women, because it's obvious that women have been left out of the table, but we're back. So we need to have conversations. We starting within your home. You need to have conversations with your daughters, with your sons. You need to ask them questions. What's going on with your body? Yeah, I know young people. I have 3 teenagers. They don't want to listen. They don't want to hear. But you can't stop. You have to keep asking questions. Are you okay? What's going on with you? Is there something I need to know? Do we need to go to the doctor? Do we need, because doctors, you can't care yourself. So you need to look for help. Is there something we need to talk about? How do we help you? You have to keep asking questions. You can't just say, oh, everything's okay. If you don't, until you start talking about it, I love it. Until you start talking about it, you don't get any answers. A closed mouth, we know what that means. So
Yes.
we have to, every woman, talk to your nieces, talk to your sisters, talk to your mothers, talk to your daughters. Our mothers did not talk, but we can change the literary. We can change the story. We can start talking to people to get information about what we're going on. And if it means talking to your doctor, that's what you have to do.
You have to do that. Thank you so much again. Somebody says here, and those on YouTube, thank you for being there. You're not left out. I'm thankful that you're sending in questions. It said, what? I think she answered that question. And she said, from 40, you could start seeing signs of menopause all the way until, 50 something. So that is there. She said that already. That's one question. I'm trying to see the other questions. It said, okay, good. I never had any menopausal syndrome. All I knew was that my menstrual flow became irregular for some time and then finally stopped. I attribute this to my imbibing a healthy lifestyle, diet changes, proper hydration, sleep, and did all this early in my 30s. So I had no symptoms at all. I'm so happy for this person. Very, very happy for you. And I was going to go to that, and that's Kendi sharing with us. I think that's an amazing thing, not to go, of course, at this age, I have friends that will say, oh, I'm feeling the hot flashes and all that. And I say, hey, I think I'm dealing with insomnia. So I'm not at that stage I can say I'm menopausal yet, but I know I'm moving towards it. So for me, I think it's sleep. So I think it's sleep, and I'm trying to work on that, do things I can do. But all the other symptoms, really, I haven't felt. And it's not because I'm fantastically, I used to be, like that, the gym and all that, but I actually cooled that on that for a bit, to be honest. But in reality, I think also our genes would speak to this. What do you think? That,
Well,
genes.
So it's not just genes. So menopause, right? When you're going to menopausal, perimenopausal state, we have decrease in our hormones. And one of the symptoms when you start decreasing in progesterone is insomnia. So you start, so that's one of the symptoms. I have some, let me see if I can find it. There are specific symptoms. We talked about mood swings. We're trying to get things, but that is one of them. When you have decrease in progesterone, you start having imbalance in your hormones, reduce sleep, stuff like that. So, or some women, if they are like me, I've had an IUD. Since how many years?
Forever.
So of course, forever, right? So you go into menopause early or no menstrual cycle because the progesterone thins out the lining of your uterus. If your lining is thin, you're not going to bleed, because remember I said bleeding is shedding of the lining. So the lining has been shedded, right? So now you ask yourself, are you truly in menopause, or are you menopausal because of
the IUD
medications, right?
Okay.
So how do we find out if you're truly in menopause? Is by
See your
blood test.
doctor. You take us to your doctor again.
She's gonna take
Yes,
us back to the hospital. We
yes,
always have to go back to the clinic. Oh, my
yes,
goodness.
so that they can check your levels to see
Okay.
if you're truly in menopause.
Hmm.
And yes,
Okay.
one of the treatments and stuff like apart from hormonal replacement, like I said,
Mm-hmm.
antidepressant, diet and
And
exercising,
exercise.
some of these symptoms, you're basically looking at what are your symptoms, helps your mood, helps your, these things reduce stress, all these
Mm-hmm.
things help you with, depending on your symptoms.
Okay. Is there a correlation between HRT and breast cancer?
So again, history, right? It depends on your history and it depends on the amount. Sometimes taking estrogen internally, especially if you have a health family history of breast cancer or anything like that. So those are things you don't have to take it internally. You can use transdermal on the skin because it is not going through the bloodstream. It is just helping to it will spread in the skin, but it's not going through your
The blood.
bloodstream. Correct.
Okay.
So
Okay.
depending on, let's say somebody has breast cancer, that's not my area, but there are some receptors that are like estrogen or progesterone receptors. If they're negative or positive, then they
Mm-hmm.
should not use. A lot of my colleagues, breast oncologists and stuff, do not like their patients to be on HRT. So
Okay.
in that instance, let's say they're having vaginal dryness or whatever that could be, they're over-the-counter vaginal moisturizers that the
Okay.
one can use. They're not as good as hormone replacement because it's not replacing anything. It's just giving you that benefit of it being able to enjoy your partner. Now, there are other medications that are coming out now too that are non-hormonal treatments, but they're very new, very expensive, and they're still being
Tested.
investigated, tested.
Okay.
Yeah. One
Okay.
of them is called Vioha, Veohat. It is a non-hormonal neurokinin stimulator that they think works well. So there are a few of them that are coming out that are non-hormonal to help women with postmenopausal symptoms.
Okay. All right, thank you so much. I'm thinking about, all right, the men on the platform. I would love to hear a question from you. You can send your question to us or tell us on mute, because I think it's important that men are, they're stakeholders in those women's lives, right? So I think it's a good time for us to be able to get from the men too. So if you want to just let us know. Somebody else is asking, say, okay, so now we've heard all the stories. She says horror stories about night sweats and all that. And what are remedies apart from HRT? What are remedies? I would say upfront, like Kehinde Adedayo just shared with us. What she says is healthy lifestyle that she started in her 30s. So even if you are 40 now, or you're 50, you can still adapt, to a healthy lifestyle, eating properly and
Supplement,
exercising. Yes.
supplement your supplemental. So every woman over 30 should be taking calcium on a daily basis. That helps your bone.
Wow.
And
Are
a
you
lot of us are
serious?
not doing it, including me. Yes, because your bone health starts decreasing. You remember estrogen is decreasing. Estrogen used to help
Yes.
replenish new bone formation. So
Okay.
calcium helps. So if you're decreasing, you should have been taking calcium and
How
vitamin
much
D.
of it? How much of it a day?
I'm trying to remember on top of
You
my
have to
head. I
stretch
think
it out.
it's
Okay.
like 600, something like that.
Are
BID.
you?
Uh-huh.
Okay.
Yeah, so you take that twice a day.
Okay.
We should have been doing that. Or it's good to find the ones like vitamin D, calcium with vitamin D. They're over the counter. There's some for women, Centrum A to Z, stuff like that. It's good to start replenishing some of your supplements, right?
Mm.
like she said, exercise. You don't even have
Yeah,
to do heavy exercise. Just
at all.
listen,
Yeah,
on YouTube, there's so many exercises that you can even do just staying at home, inside your
in your
house.
hands. Yes.
I sometimes on YouTube there are these exercises for elderly women, just getting your chair, doing different little things.
And that's if you're elderly. If you're not elderly, you can still walk around.
I mean, if you want to start from somewhere. So I throw things
Yes.
out like
Okay.
that, just, to
Okay.
encourage people to start from somewhere.
Okay.
If you
To
feel like you
start.
want to low impact, start something. Yeah. So just little changes. It doesn't have to, it's not overnight. Everything takes time. If you're not used to it, if it's not your culture, you want to start little by little. Start paying attention to what you're putting in your body. What are you eating?
Mm.
You want to, I
Mm.
talk about this in nutrition. You want to look at labels.
Mm.
Anything too much salt, you want to reduce your salt intake.
Mhm.
You want to pay attention to anything processed, that you're not used to eating. You want to be careful with that. So
Mhm.
when you're looking at labels, sugar, salt, you want to
Mm.
reduce those things. Okay.
Reduce salt, reduce sugar. Definitely. Sugar is one big thing that we all get in, and we don't even know how much sugar we take in because we're thinking about just the sugar you can see. There's sugar in practically everything that we eat these
Everything.
days. And we need to pay attention to that. Thank you so much. I'm still expecting us to get more questions, but I'm looking at some of the things I had gotten down before we even got started. What about, okay, we're talking about remedies. Remedies for vaginal dryness. So women that are experiencing that, apart from HRT, what can they do?
I'm sorry, repeat that question again.
Okay, apart from HRT, if you're experiencing vaginal dryness, what else
Yeah.
can you do
Okay,
other than
so
HRT?
okay, so I think I mentioned some already, right? There are excellent vaginal moisturizers
Okay.
that one can get.
Mm-hmm.
Exercise, and there's specific exercises called pelvic floor. Uh,
Like the
uh,
Kegel?
Kegel is good, but they're pelvic floor physical therapy, right? They're like specific.
Oh,
And what does that do? It helps draw your blood supply to the vaginal area. They teach you how
wow.
to do specific exercises for the pelvic area. And
Oh,
some of us, our muscles down there in the pelvic floor are so tense. So this helps with those
to
pelvic
relax them.
muscles to relax them, to release them.
Ah,
It is pelvic floor physical therapy is excellent. It can help with anything.
pelvic
Some
floor
women,
physical therapy. You can hear that. Please write it
yeah,
down and share.
pelvic floor, yes.
Wow.
Especially women, as we get overweight, as we're,
Mm-hmm.
after childbirth, there's so many changes going on in our pelvic floor.
Mm-hmm.
You start experiencing prolapse, you're not sure if you're having bulging or something like that. So all this just kind of helps strengthen the core of your pelvic. Okay.
Your pelvis.
Um, and I mean, really, that's the things that you have to do, pelvic floor. And then with menopausal, you're really addressing the symptoms that you're having to have a quality life, right? If I'm not eating well, I'm not sleeping well, I want to be able to address that. If I'm having mood swings, you want something to help you with that. And
Okay.
there's nothing more. I believe you said Kane has kind of addressed most, it's changing your diet,
Yeah.
changing your
Lifestyle.
lifestyle is biggest, number one. Lifestyle. I don't know how else to say that, but lifestyle.
Lifestyle. So we have to make wise choices
Wise
earlier,
choices
and then whatever
earlier.
point you, yes, and whatever point you are now, you can still make those choices. Don't say, oh well, it's too late. No, you can start. I saw the video of a woman that had never worked out until she was 52, and she's 57 now, and I was like, what? Her body looks amazing. So it means that you can start where, whenever the realization comes to you, is the time to start. Remember that we're talking about, let's talk about it.
I call it rebranding. I call it rebranding.
Rebranding.
Yes, I call
Okay.
it rebranding. I mean, for example, I just met my sisters and they're like, "Oh, you're looking so young." I'm the oldest. And I'm like, let me
It's
speak my Niger
rebranding.
English. sit down there, you know.
Yes, so we're not gonna
You
let it
know,
go. We're not
yeah,
letting it go.
you have to be intentional. Nothing happens without
By
you working
accident.
at it. You
Mm,
have to be intentional. You have to
intentional.
keep working at it. And I mean, promise you, it would happen. It would change. You will see,
Mhm,
you will see, you enjoy the life that you're living. And that's the goal. You know, you want to be able to enjoy the life you're living. And
mhm,
I want to challenge any woman on here,
mhm,
the things you're experiencing. Have you gone to search for help? Have you
mhm.
spoken? Have you checked your labs? Have you gotten your blood test? It may not even be menopausal symptoms. It may even be something else in your body that's going on that you need to check. It's very important that you see some. Oh, thank you. Somebody just posted something about physiotherapy in
Uh-huh.
the chat. So it's very important that you keep a diary,
That's
that you
Sarah.
get yourself
Thank you, Sarah.
self-care. Yeah, self-care is very, very important that you spend time noticing the things that are going on in your body. If you're not good to you at yourself, you can't be good to anyone.
Thank you so much. And thank you, Sarah, for posting that. We just heard about pelvic floor physiotherapy, and someone just posted. That's why Let's Talk About It is a multitude of counselors, the community of counselors. We've been here, we've been listening to our specialist today, our expert today, but at the same time, we're getting information from other people. She spoke about it, but she just put a link there for us to share and to take home with us, so please, work on that. Someone spoke about, asked the question and said, what about hair loss? She's experienced hair loss. I wonder how many people have experienced hair loss due to menopause. Is that related, or maybe that's something different for the person, and the person is just mixing it up?
So yeah, like I said before, you need to get hair loss. You need to make sure there are different reasons why you can be having hair loss.
Mm-hmm.
It can be genetics. It can
Mm.
be your thyroid. Remember, I said thyroid. Thyroid, if it's hypo or hyperthyroidism, can cause hair
Mm-hmm.
thinning. So it's very important to get that done to make sure that
Mm-hmm.
they can rule out. Yes, it can happen with menopause, but it depends because remember, estrogen is like air. Estrogen is to a woman like air is to life to all of us. So
Wow.
estrogen takes care of everything.
Mm.
Remember, estrogen is part of our puberty, when we're going through puberty, the changes in a
Mm-hmm.
woman's body
Mm-hmm.
and all this things. So you need to make sure that you're checked to make, so different things can be happening, so you need to make sure that you get the right information to know which hormone is low or high, decrease in your body. So
Okay.
get that checked.
Yeah. Okay. All right. Does anybody online want to share their own experience? So we can unmute you. Just let us know. Remember that we're a community of counselors here, and we share experiences. We've heard so much of the medical field and, infiltrating even into other areas as well, and people giving counsel. But if you want to unmute and say, you know what, this is my experience, and share with us, or someone that went through it and you want to share, please let us know. We'll be very happy. I'm thinking about I think it's Mrs. Kendi Adedayo. I'm thinking it's Mommy Adedayo that sent that. If you're willing to share, Ma, I'll tell them to unmute so that you can share. If you're in an area where it's quiet and you can speak, I'll be so happy if you share all that information with us so that we can be like you and not go through all these symptoms that we've spoken about here today. I will just wait for a few minutes while I'm looking at, okay, I have something in the chat. Oh, just that again. All right. I was just trying to check the chat to see whether there was something else that somebody had put in
So
there.
yeah, that while we're waiting, I just remembered something. There
Yes.
was a patient I saw
Mm.
this week, and she had a medical condition called I want to say acromegaly. I'm trying to remember her. I'm trying to read her chart in my head. I want to say acromegaly, something, some kind of bone disease that where she has short fingers, short, everything was like, like nubs, sharp ones. Even her nose, the bone, everything was like, it was only in her early 30s, and she's having severe menopause, severe menopausal symptoms. Already, like hot flashes and everything. And we did all the tests and everything, her hormones are still normal, like things were just off, right? And that's why sometimes you need to check a patient individually. You have to tailor their treatments. It's not one size fits all. You have to tailor their treatments according to that patient. Anyway, we gave her an off-label medication that was recommended called clonidine. And she takes, and her migraines, her hot flashes, everything disappeared. She came back to the clinic asking that she need that. Clonidine is a medication that we use for some people for high blood pressure, especially during pregnancy, low dose, and it cured her issue.
Thank God.
She was it cured her headache, it cured her hot flashes. Yes.
Just like that.
So sometimes, it's not just sometimes, all the time. That is why I tell people medicine is partly clinical and partly history. You need to get the full history of that patient to be able to help them. Yes, to be able to help them with their issues.
Oh, thank you for sharing that. I'm so happy that woman has all the relief now. So please, can you please unmute?
Yeah.
Okay,
there is Kehinde Adebayo that wants to speak.
Yes, can you unmute her, please? And when you do, please just let her know that you've done it.
Yeah, he's done it.
Good afternoon, ma. So I was right. Good afternoon, ma. Thank you for always being here, mommy. Thank you, ma.
Thank you. God bless you.
Yes, ma.
Like I said, I actually didn't know when I got to menopause. The first thing I discovered was that my menses will come 3 months, 2 months. After I just missed it for a whole year, I had no issue. But before then, I had been on healthy lifestyle because I had several health issues that took me to healthy lifestyle. So up to today, I'm over 70. Up to today, I still eat more raw food than cooked food.
More raw food.
Yes, and these foods actually they contain a lot of antioxidants, estrogen replicant type of nutrients. So that the estrogen that drops and makes it to have all these issues at menopause, it's not being replaced by your food instead of maybe being injected and all that by what you eat.
Yes.
Then, there is a way exercise also helps you. So when I'm talking about food, I'm talking of more plant-based foods. Fruits.
Okay, mommy, give us the examples, ma.
What I'm eating right now is an example. Maybe I should just turn my camera. What I'm eating, I'm just having my lunch.
We can't see it yet, ma. You have to raise it a bit higher for us.
Lettuce, tomatoes, onions, and I was just I was eating it and just saw the mess that it will be on by 3. I just joined. Tomatoes, onions, lettuce, carrot, cabbage, and all. I think that contain a lot of estrogen that will help you. If you eat them, most likely all these things we introduce synthetically, you had them from your food.
Yes.
So I didn't know when I got to menopause, and it just came like that. Then I make sure that I detoxify once in a while. There's so much toxins all over the place. I went to the market today. I had to record palm oil. You see the ones that are adulterated. You see the ones that are pure. I took the pictures today for my own health talk. Because this things already introduces several things into our system, several toxins, several oxidative stress that further stresses us when we are going through menopause. So I say, if you see this type of oil, don't buy it. If you see, buy this type. You get to the market by 4 p.m. in the night, in the evening. There's no single fly on the meat on the market. Why by 6 a.m. if you are slaughtering cow, there'll be a lot of flies. There's no single fly by exposed meat, no net, no nothing. There'll be no single fly. They have applied chemicals. They have used
Ah,
chemicals. Yes, they have applied chemicals so that flies will not perch on their meat
on
anymore.
the meat. That's
Yes,
dangerous.
it is.
Sorry,
So
Ma.
most
I
of
have a question for you, Ma. I
okay.
am so happy and so grateful. I mean, it's like she summarized my whole talk today. I am so happy for you. I am so grateful to you.
Thank you.
I just want to know though, because you said you didn't know when you went into menopause. What
Yeah,
was, and I heard that you said you had some health challenges, and that's why.
yeah.
So
Okay.
who advised
In
you
my,
to do those things, and what made you, because you said estrogen, so I'm impressed.
yeah,
You knew that the food you were eating based.
yeah.
Were you told to read these things, or were you advised
Um,
by
um,
somebody?
I'm a retired matron. I know all that, but when I had all my health challenges, I dropped what we were doing in the hospital. I saw the face of God on what to do. You see, I had arthritis, I had high blood pressure, I had my sugar was always on the high side, cholesterol, the same thing. In fact, at 42, I was told I had cancerous cells in my cervix. And this
Can
really
you
tortured me.
imagine?
Yes. I just
Hmm.
decided, I have been in the hospital for so long and I know what
Hmm.
it is. So I decided to
Yes.
take my health in my hand, trusting God. So I tried to
Yes.
research and I went into nutritional health.
Research. I just wanted to make everybody hear what she said. Research. You
I am
have
so
to
excited
read.
to hear this.
Thank you so much, Ma. I wanted to get the important information what she's saying. Research is very key. She spent time, she learned, she researched.
Yes, and I asked to ask God. People were living in early ages, up to they said
Hmm.
900 years, 950 years, and the person that died earliest then was 360 years old, and
Hmm.
Moses at 120, his eyes did not dim. He was still climbing mountains.
Yes.
At 100, they
Yes.
said Sarah was still beautiful to behold. What were they
Ah,
doing then? That was they were definitely doing something different
definitely, mommy.
to make
Definitely.
them strong and healthy and still look very okay. So I
Yes.
decided to go spiritual as well. Ask God, what do you want me to do? How do I manage? I don't want to go through all this cancer, that cancer, irradiation, chemotherapy, and all whatnot. So I thought, and I knew that God gave us instructions. He made this body.
Hmm.
Anybody that manufactures anything will give you a manual how to take care
That's
of that
right.
thing. Gave me a
Yes.
manual on how to manage this body. And the manual is Genesis 1:29. All plant-based food, all these fruit-bearing seeds and all, they are for you for food. And in verse 30, he said, I've given you all the greens for
Hmm.
food. He said, Psalm 104, verse 14 says, all herbs and spices are for your service.
Hmm.
Revelation 22 says, leaves are for our healing. The same thing in Ezekiel. It's all placed all over the Bible. But
That's right.
we are neglecting all this. The more we will move away from God's own food, God's own recommended way of handling this body, the
Yes.
sicker will fall.
Yes.
So
That's
I
true.
decided to go that way.
Go
In
back.
fact, because of the cancer, I was afraid. I went on raw
Yes.
food for 6 months because I didn't want to. When the doctor said,
Wow.
you need very less. And they said I should be doing pap smear every 6 months. Usually
Hmm.
then, it was once in 5 years. These days, because of the
Hmm.
prevalence, it has become, I've made it once in 3 years. But then,
Yes.
it was once in 5 years.
5
So
years.
if the doctor says you should be doing it every 6 months, you know there's fire on the mountain.
Of
It was that
course.
fire I wanted to remove and saw the face of God, researches and all that. And to the glory of God,
Wow.
the cancer, I was attacking cancer, but in the process, all other things, the blood pressure, the hypertension, I couldn't climb stairs. At 38, I called my husband. I said, if you want to build a house, please don't build a story building. If you do, I will not park there with you because my knees were my knees were so bad. I had to support one before I take the other one. But now I live on the terrace and I can run up the terrace, So I just
Hallelujah.
went, to keep it short, I don't have the whole day, I'm not invited everybody. I just went natural. I changed my life to a natural lifestyle, going God's own way, going, imbibing God's own natural laws of health. And that served me, the health I'm enjoying after 70, I did not enjoy it when I was in my late 30s and my 40s.
40s.
For the glory
Mommy,
of God.
thank you so much.
So God bless you.
Honestly,
So,
Mommy, you're always there, and I'm
vibration,
so
sleep, and all.
appreciative. But we're bringing you back as a guest to teach all of us
Sincheze, I know you're going to be there on that day.
Yes.
God bless you.
Thank you
Doctor,
so
you have
much.
done fantastically
Congratulations,
well.
ma.
Just a minute. Mommy has one thing to say. Yes, ma.
I say I'm thanking the doctor for all the information because women need to know all this. Women need
Yes.
to know all this, and we need to know that menopause is not a sickness. It's
It's
something that
not.
can come. It's something that will come, and I see women carry fan and all that and say, yeah, epele. You know, God bless you, doctor. I appreciate you.
Thank you so much,
Thank
ma.
you
I
so
am so
much,
happy
ma.
for you.
Thank
Oh,
you.
Nike, you have been so
Congratulations.
great. You have been so wonderful. I said I don't see. If you don't see me online, it means I missed it.
Thank you, mommy.
And
Thank
Congratulations.
you
most times
so
I go back
much,
on
ma.
YouTube to go
Yeah.
through.
I'm so
God
grateful.
bless you.
Thank you for your support and encouragement always, ma. Very, very
Thank you.
Congratulations,
Thank you.
ma. Thank you so
Thank
much.
you. Thank you.
Congratulations. I
Thank
appreciate
amazing.
it.
Amazing, amazing. Thank you so much, ma. And I'm see, when I was saying whatever points you have that realization, you can still have a turnaround. That's exactly what has happened.
Rebranding. Rebranding.
Rebranding, mommy
Rebranding.
rebranded, and she's enjoying her 70s. Honestly, I'm clapping and applauding as well. I have to read this question very quickly. Like I said, we're bringing mommy back. We're going to do a healthy, we're going to have a topic, and we're going to have her back so that, because honestly, I don't know the number of friends that have said, I can't bend down anymore. My knees are hurting. I'm in my 40s. I'm in my 50s. And mommy is in her 70s that she's climbing stairs. Imagine from someone saying, don't build a house with stairs at 38. Awesome, God. I'm really enjoying this. I'm sure you're all enjoying yourselves too. I'm going to read a couple of questions quickly. Good. So, Sinchi, this is for you. It says, oh, thank God. So this person is saying, what are the side effects if a woman stays away from sex for so many years? She's a single mom. She just clocked 40, and she's noticed that she's having serious headache, insomnia, high temperature, cramps, and all that. Is this, are there early signs of menopause, or is it because she's abstaining for so long because she's a single parent? So you have three questions in one. Number one, and you're the right person to ask this question because she has. Yeah, I know you'll give it to us the way it is. What are the effects with staying away from sex for so long? You're not a married person now, okay? So we're not encouraging a young girl to go run around or anything. And this person is 40 and she said, I'm a single parent. This is what is going on with me. So that's number one. Number two, are there benefits of having sex as a married person? So we're looking at both sides now. Okay, are there benefits? And then number three, all the symptoms that she's having, is it because of the lack of sex, or is it early signs of menopause? You have your questions cut out for you.
Okay. So there is nothing wrong of abstaining from sex. It has no side effect. It has nothing. So don't attribute that to because you're not having sex. As a matter of fact, remember in the Bible, what did Paul tell us to do? He said, he has chosen to abstain, right? But if you can't, then you get married if you can. But it doesn't mean that there's anything wrong with you. The Western world, everything on TV, as a matter of fact, everywhere, all over the world,
All
it's
over the
about
world.
sex. It's like sex, sex, sex. That's not true. You don't have to have sex. It is not it's not a death sentence. It is not punishment. There's nothing wrong with you. So it doesn't matter. It's just a 2-second or 30 second, however, how far gratification. No, and it's for procreation. There's nothing wrong with you if you're not having sex. However,
it's for procreation only, Sinchese. Is that what the Bible says?
No. I'm saying you can't say because you're not having
No.
sex that something is wrong with you. No.
Good,
See,
good.
I want
I
to
wanted
make
to
sure of it.
clarify. I wanted to
Yes.
clarify.
Yes. Now, of course, as a married couple, having sex is a bond forming, relationship. It is fine. But if you two have an understanding and you're still relatable and relating to one another, then if sometimes when you're not having sex, it's understandable. Some people don't have sex because there's one thing or the other going on in the relationship. health-wise or whatever the issue may be, that's
Yeah.
it. Everybody has different things happening in their relationship, so you don't, that defines their relationship. So it's not one size fits all. What happens in A does not necessarily happen in B, and what works for B may not necessarily work for D. So what is sex for? You have to find out how your relationship, how do you guys value that? How does your partner, must he have sex all the time, or must she want sex all the time? It's vice versa. It's not always the man, it's not always the female. It depends on what works for your relationship. I don't know. Did I miss anything in
Okay,
that?
no, you've answered the sex part. So what about the symptoms? Those symptoms, are they signs of early menopause?
No, so there is no signs. Like she said, headache. She said, what else did she say? Headache. What else did she say?
She says she's having insomnia, headache, high temperature, and cramps.
Okay. So she needs to get examined. Cramps, she's 40. So is it during your menstrual cycle, or is it just cramps? So there are different things where they need to be more time to spend on her history. Are you cramping during your period, or is it like you're cramping all the time? Insomnia can be as a result of anything. At a 40-year-old, you probably haven't decreased estrogen. Yeah, it could be perimenopausal symptom. It could, right? Because your hormones are decreasing, but you can't use one thing to isolate a diagnosis. She said headaches. Are you sleeping well? Okay, she's having insomnia. So insomnia can lead to headaches. Are you drinking enough water? Are you hydrating your body? So those are things you need to check, right? How your hydration, because if you're not hydrating, you can also have headaches. You can also have lack of sleep. Are you overworking yourself? Stuff like that. So I'm basically trying to make sure that you're not jumbling everything, and that's a lot. We do that a lot, right? Because I'm experiencing
as women, especially.
because I'm not right. And we want to, what's the right word? We want to gloss over it so that we don't go see a doctor. Oh, I know what's going on with me. Oh, because I'm not doing it, that's why this is happening to me, or blah, blah, blah. No, please see somebody to get thorough evaluation. Make sure you're drinking enough water, you're hydrating yourself. Make sure, okay, are you cramping? Because some people don't cramp before and then they start cramping. Like maybe, I know some people who early in their period, they had worse cycles and then later they didn't, or vice versa. Some people have no pain and then later they start experiencing pain. So all those things just need to be evaluated properly. Okay. That's a good question, though.
Thank you so much, Sachi. Yes, very good question. But I think you have a rebuttal right here, because a man just sent me and he says, so as a married man, let me read it out the way he says, so now I'm speaking as a married man. Why is it now said that a woman is glowing and she looks amazing because she has good sex with her husband, and you said the man is more relaxed, and here you're saying you don't have to have sex, it doesn't affect your life? I do not understand.
He said, somebody said, okay, let me make sure I'm digging into this. I think a man doesn't attract me. No, that's what I'm saying. How do you know? Yeah, she's probably glowing because she's happy in her relationship with her husband. It doesn't always have to be as a result of the sex. I mean, like some women have sex all the time, and guess what? Glow. They hate it. Yes. And they hate sex, but they're just happy with their partner. So it really depends. Like I said earlier, every relationship is different. So she may be glowing. Yeah, she may be glowing because she had good sex. Yes, that's possible. I'm not saying that that's not possible. Definitely. There's sometimes women, when they have sex, like I can tell when some people like in my office, there's a glow, there's a pep in their walk when they come in.
So is that true? So what you're saying is real?
It is real for some people.
Oh, I thought it was the movies. I thought it was in the movies that you just hear that. Okay, all right. So I guess you've answered that question. The next question, because we're now rounded up, we have 20 something minutes left. The next question is, does menopause affect breasts?
I guess I will have to understand in what way.
Did you get that?
I need to understand
I don't know.
more.
So does menopause affect breasts? Okay, let's maybe they'll get back to us.
Yeah.
Okay. Well, honestly, it's been an amazing conversation here today. We've heard so much. Those of you on YouTube, thank you for being there still, and those that are logged in here, and all the information we received has been amazing. And someone just passed a comment and said, "Mommy's testimony is for both genders, so it's both for male and female." So the guys that have logged on, it's not about because she's a woman. Men go through their own, reduction in everything as well too.
Well, men's menopause is
somebody told me
when I said men go through
andropause,
menopause
right?
when they don't have money in their pockets. So what?
You're not serious. You're not serious.
When there's no
honestly,
money,
I read somewhere. You're not serious at all. As you can see, she's my friend, so we always have good laughs, obviously. Well, so I read somewhere that men go through a kind of menopause, and it's called andropause or something like that. I don't even know whether that's a scientific thing, but I read somewhere.
It is no, it's not. It's not. It is it is a male hormone, that they can also have decrease of, and they can have different symptoms. Because men have their own hormones, women have their own hormones, but true menopause is in a woman. Okay. But yes. Okay.
All right. Okay. So the breast person says, person that asked the question about the breast, sorry, I didn't mean that. The person says, does menopause affect the shape, the size, and the touch or the feel of breasts, of the woman's breasts?
Well,
that does menopause affect that?
I'm not sure. I mean, yes and no, right? Because you're decreasing hormones. Remember, it's the hormones that made us puberty. Woman's bust comes out, all your body parts and everything. So of course, as you're declining, there will also be a decline in, how robust your body's looking, how yeah, because that's all has some kind of effect. So yes, as we're aging, as the hormones are decreasing, the glow and the stuff you see in your body start changing. And that could also apply to your breast tissue and stuff like that. So things start decreasing, correct. However, because initially I was getting confused with whether she was talking about if it, gravity also has its own effect, is basically what I'm trying to say. Yeah.
Okay. And so they're asking about complexion. What about a woman's complexion? Does menopause affect your complexion as well because of the hormones?
So yes, your skin can change. Sometimes, of course, when you dry, as you kind of looks a little, that's a little bit more, what's the word? Synergistic with other hormones, right? So because all these things there's a hormonal system like the endocrine, the brain, you have the thalamus and everything, you have brain fog. So those are some of the hormonal symptoms that you can have. Some people have.
Yeah, the brain fog.
Yes.
The brain fog.
Yeah, so estrogen affects everything. That's why I said estrogen is like life to a woman, like air is to a woman. You can have brain fog. That's why you have mood swings. Some people it comes out as mood swings, but it's because there's something affecting your hormonal balance in the brain, right? And you have these spurs of brain fog where you can remember something right now, and you're like, wait, I was trying to say something, and I'm like, oh, I forgot, and then it comes back. It's like little so yeah.
And that can happen to at any age, or we have to be. Okay, hear me. Okay.
realize, you want to say something and then you're like, oh my goodness, what was I trying to say? And you've forgotten, just like you have said. Just like, I guess that's why we should go to school earlier, so that you don't have to go through all that. You don't have to go
I
through.
know.
It's been such an amazing conversation.
Thank you.
Honestly, amazing
I enjoyed
conversation today.
myself.
We've learned so much. Yes, thank you for being here. We've learned so much and gotten so much information as well. Okay, so I'm going to be asking this question. Does anybody, Damilola Queen, do we have any other questions from YouTube, from personal things sent to you? Anybody? Or does anybody on the platform have a question now or an experience to share? Mommy just shared hers, and I'm so excited. Is there anybody else? Okay. All right, so I think I have one more question. Is if you have a history of fibroids and hormonal therapy after breast cancer, and your period comes back after 1.5 years, what could be the cause of that?
So you had
Let me read that again.
Yeah.
If you have a
let's
history of
let's
fibroids,
take one question at a time. So there's several
okay,
things in that question, right? So
okay,
she had
yes,
fibroids. Did
yes.
she say she had surgery for that fibroid, or what did she say?
She had, no, she said, let me read it out. If you have a history of fibroids, hormonal therapy after breast cancer, and your period comes back after 1.5 years, what could be the cause of that? So she has a history of fibroids, and then she had hormonal therapy. And okay, if the period
What
came
was
back
the
after,
hormonal therapy? What was the hormonal therapy exactly? What medicine did
hold
they
on,
give her?
if
Did they
the
give
period, if the period came back after 1.5 years, then 3 months after, and you've been checked for cancer and it's negative, what next? Because she had breast cancer, she's negative, she's totally in remission, but the fibroid is still there, and the hormone
Yes.
was
So
tamoxifen.
tamoxifen. Okay. So
Tamoxifen. Okay.
I'm not a breast specialist, but we do work
Okay.
together, and I
Okay.
know that tamoxifen. So fibroid. Let's start with fibroid. Fibroid is a non-cancerous tumor that
Okay.
causes bleeding in most women. Not necessarily in everybody, but some women it causes abnormal bleeding, and especially depending on where it is located in your uterus. That's how they know there's something wrong. They come in, if they have fibroids. It's not cancerous. Depending on how big it is, they may advise you to get it removed. That's why some people have surgery called myomectomy, where they go and remove the fibroids. Or depending on their age, they may advise to remove the whole uterus. So I will ask, first of all, how old is she?
She's in her 50s.
In her 50s, okay. And
Yes.
she didn't obviously sound like you did not remove the fibroids, and they were giving you tamoxifen for breast cancer. Now, breast cancer, tamoxifen has some side effects that could cause, not always, but could cause uterine cancer, or could cause abnormal bleeding. So whenever a woman has breast cancer, she's on tamoxifen. They're advised, if there's any bleeding, to see their gynecologist so that we can do a biopsy to make sure that there's no issues in the uterus.
Okay.
So
Okay.
you're probably bleeding as a result of the tamoxifen.
The tamoxifen.
And it's probably nothing. It's probably nothing,
Okay.
but it's important to check. So it kind of stimulates the lining of the uterus, and you have some bleeding.
Okay. She said no side effects from tamoxifen in the past 5 years.
Okay. So if there's no side effects, I mean, you also probably need to get your check to make sure your fibroids is not growing.
Okay.
Tamoxifen, you should only be on it for 5 years anyway. They should be talking about removing you from tamoxifen.
Okay. Okay.
So, but
Thank
you
you.
need to talk to your healthcare provider and the people who put you on
Yes.
tamoxifen, and make sure you see a gynecologist.
So don't continue after 5 years. And honestly, thank you. I just want you all to celebrate this friend of mine. I'm not going to call the name, but that's the person that sent all those questions. And God has been so good to us. Cancer is in remission. She's negative. And I'm so thankful to God. Every time I see or read anything from her, I'm just thankful.
So please just help me thank God and celebrate this amazing person. And she's doing a lot of work with other people as well. Thank you for sharing all this information. Thank you, dear. Thank you. And what the Lord has started, He's made permanent already in Jesus' name.
Amen.
Amen. Amen. Thank you. All right. So I'm going to have this final question, and then we're going to be able to release Dr. Sinchi. There's no other question. And that question is from a guy, and it says, how can I help my wife through menopause? What do men need to do? How can they help? Or you just
Wow.
watch the person go through it?
No. Thank you so much. You know, as a man, I'm happy that you asked that question. You know, men have mothers, wives, sisters
Yes.
that are suffering, and it is very important to pay attention, because this is the person you've been with and you know how they were and you see some changes. So, I mean, you being supportive is really number one, and that is the best thing that you can do for anybody, is to be there for her and support her and help her go through research. Change, you know, like sometimes when you're going through things, it's hard to even research. It's even hard. I know it's easier said than done, but we just have to do it. So you can help her by, hey, babe, let's make an appointment. Let's make sure things are okay. Let's research. I like what mom said, Mommy Kane, they said, you know, look at your diet. See, what are we eating? Do we need to make changes? You know, it's a very, do we need to talk to a therapist? You know, whatever to get the conversation started to see exactly what is going on. Depending on what she's experiencing, is she feeling dry? Is this, you know, why this is also, you know, she's not enjoying sex, or you're not having a good relationship in the bedroom, you know? So see what's going on. Do we need to add other things? I also tell partners, you know, sometimes as we age, as we get older, you know, when you're younger, it was easier to just, oh, let's have sex or let's make love or whatever. But as we get older, women are bogged down with so much, so are men, that you kind of have to make love to the mind before you can make love to the body, right? You have to get her in that space. You have to make her feel lovable so that she can give up. So those are some of the things that are very important. You know, you need to make sure that she's feeling, you know, remind her how much you care for her and get her mind prepared. Is very important that we do that for one another, because it's no longer wham bam, thank you, ma'am.
Thank you so much. I hope that answers his questions. I have one more question from a first timer on Let's Talk About It, is the dear sister, and that's the Honorable Fumi Tejosho. Thank you for being here. Thank you, thank you, thank you. She sent this question, is on the platform for everybody, and she says, people talk about hot flashes. What about cold flashes? What supplements can we use? So what are cold flashes?
I'm so sorry. I'll revert. I'm so sorry. Yeah, we said half flash, but I actually call it vasomotor symptoms. That's the medical term, right?
Say that again.
Just vasomotor, VASO.
Okay, vasomotor symptoms. Okay.
Vasomotor symptoms. So that is hot and cold flashes. It's just that people drop the cold, right? But it's really hot and cold flashes. And you can be experiencing either or. Okay. To be experiencing either or. Some people have flashes at night, hot flashes in the day. Some people can be like, right now we're working, like I have this colleague, she's in her 60s. We can be working right now and she's like so cold, she has a cold. And then she'll come back from another patient. Whew, whew, whew. She's like fanning herself. So, you know, it happens that way. So it is really called hot and cold flashes.
Okay.
So it's the same treatment.
Yeah.
I'm sorry.
The same
Thank you so
treatment.
much for pointing that out, that we make sure.
Okay.
So it's called vasomotor symptom. Yeah.
Okay. So it can be cold, it can be hot.
Yes.
Okay. Okay. And so
And that's another reason why it's important to get checked, because another thing that mimics that similar symptom is thyroid disease. Some people can, depending on if you're hypo or hyper, you can feel extreme cold, extreme hot, extreme dry, extreme moisture, facial growth, brittle hair, your thinning of the hair lining and stuff like that. So that's why you want to get checked, so they treat you accordingly. And fatigue.
Okay. All that. Okay. And I think one of the other things that someone sent a message was the hair, the chin hair. And I just say, anybody that I see that's experiencing that, take it out. Don't leave it there. You're not going to grow a beard. You can wax it, you can thread it, you can tweeze it, whatever it is that would work with your skin type, please do it so that you feel good with yourself and you feel good about yourself. Some women just give up. But I don't think any woman wants to look in the mirror and see a full-grown beard, except that's your choice. But typically, most women do not want that. So please, tweeze, wax, what else? Thread it, whatever you want to do
to make yourself feel beautiful, to feel
do
good.
it.
I mean, like, I don't know. This may not be. I'll say it. I joined my high school platform. My parents sent me to Nigeria when I was a little girl. So I went to high school in Nigeria before I came back to the States. And I sent a picture of myself on my platform, because when you come back, they say, oh, your picture, we need to see you. Somebody texts me, say, oh, is that your daughter? Why? What? Why would I send the picture of my daughter on a platform? They're like, oh, you look so young. I'm like, dude, Nigeria, some people in Nigeria, I won't say Nigerians, but they're acting like we're so old. I'm like, how old are we that we're acting like we're aged? It really surprises me that how quickly people let themselves go. And now, I'm like, I know that they think Americans are obsessed with youth, but really, God, even in the Bible, I mean, Mommy Kane, they already told us how people live. So, and we're not even, and people are acting like, yeah. So we need to be intentional. That's one of the things I mentioned earlier. Intentional about your life, about your, everything. So that, when you feel good, the way you look is the way you are dressed, the way you want to dress the way you want people to address you. Yeah. So it's very, very important.
I totally agree. I totally agree. And I'm not in the company of those that say just let go of yourself. For what reason? You don't have to. I don't believe in those that try too hard to. I'm not trying to look like a teenager. It's not worth it. I never want to be a teenager again. Why would I want to be a teenager? But I want to look good, and like who I look like, what I look like. I'm not trying to be my daughter. I'm not trying to be my nieces or no, not at all. But it's important that you look after yourself and you're comfortable with what you're presenting to the world to see. Very, very important. Okay. So we have 2 more questions. Okay, one question and a suggestion. So somebody says, you can try skin electrolysis for unwanted facial hair. Yes, if you can afford that and your skin can take it, yes, you can do that as well. Some do that. Thank you for actually saying that. And that's from Tosin Ajao. And okay, Mrs. Shitu says, thanks for this very educative session. Please, how long is night sweats and hot flashes supposed to last? I was going to ask,
I have no idea.
I don't experience that. But truly, how long is it that for the rest of your life? Until you're 70 or 80 or what?
So I'm going to go back to what I said earlier when I first started. Remember I said, the perimenopausal transitioning time can be up to 8 years plus. That means as you transition, people's timing varies. Everybody's timing is varies. So some people stop and everything's like reverse, and some people continue. So everybody's symptoms, and changes can vary depending on.
And then, sorry, Cindy, I want to have a clarification. So this timeline is from when your period stops completely or when it starts to dwindle? Because now I'm confused.
It starts to dwindle. When it starts to dwindle. Because those symptoms that you're experiencing doesn't just automatically stop or start, right?
It's not one.
It's not one, there's no, So that's what because you remember the 3 phases of menopause is you have your perimenopausal phase, you have your menopause, and then you have postmenopausal. That's after menopausal. Correct. So, it can, it transition, the phases are like, it varies. Yeah.
Okay. Wow. Thank you so much. Thank you, everybody, for being here this afternoon, this evening, this morning. If you're in the United States, like Cinchi is, and we're really excited that you're able to join us. It's been educative. It's been a community for real, where we're sharing ideas and where we have our chief expert in the house today, who's taking time off to be able to do this with us. I'm very, very thankful. As always, I'm going to hand over to those that are going to round up for us because they're going to give you more information about Let's Talk About It. But once again, honestly, Cinchese, thank you for being here. Thank you for being my friend. Thank you for being especially so that share your knowledge and your wisdom with others here. And for every single person that has tuned in today, we're so appreciative because we've learned. Mommy Adedayo, I can't say thank you enough. I'm so thankful for your support always and for sharing all that information that you did with us today. We're really grateful, and we're looking forward to having you back this time as a guest, so that we can be climbing stairs at 70, without having issues with our knees. All right, thank you. Those on YouTube, thank you for being here as well. I'm going to hand over to Carol. Damilola Queen, thank you for doing a great job with the questions. God bless you. I'm handing over to Damila Ray and Carol. They're our IT people, and they're going to take it from here. Thank you. See you next month, but please don't log off yet. They have some information for you. God bless you.
Thank you once again, everybody, for joining. Please, we're enjoying everyone to follow us on our social media platform. Let's Talk with Flakkie on Instagram. Would really appreciate that. Please, if you're not following us, please just go on Instagram right now and let's just start getting the alert that somebody just follow us now. And I'm sure if you had enjoyed yourself, thank you. We just saw there is a link to our page on the chat now. Please, everybody, just help us click. There's Facebook, there is Instagram there. Help us click, follow, like, and just help us broadcast this channel. And also, when next we'll be coming again, please come with somebody. Share our link with somebody so that we can double this attendance. And if you enjoy yourself, don't be selfish, please. please don't be selfish with that. Don't be selfish with information. God bless you all. God bless you all. Thank you all so much.
Thank you. Happy Easter.
Happy Easter, everybody.
Thank you.